Universal Healthcare Act or Republic Act number 11223 is based on Republic Act 7160 or the Local Government Code of the Philippines, wherein ang Executive Order 136 gihimo kabahin sa devolution of functions to the LGUs. In fact, the year 2022, ang DOH naghimog Administrative Order 2022-0038 or number 38 kabahin sa Health Sector Strategy. Republic Act 11518 is General Appropriations Act. RA 1080 is Civil Service. RA 7305 is Magna Carta for Health Workers. RA 11466 is Salary Standardization Law. RA 10173 is Privacy Data Act. RA 11332 is Mandatory Reporting of Notifiable Diseases. RA 9262 is Violence Against Women and Children, and Republic Act 8371 is Indigenous Peoples' Right. Likewise, ang Universal Healthcare Act was already created to meet an integrated and comprehensive approach, a whole of a system, whole of government, and whole of society approach, comprehensive health services without causing financial hardship, and people-oriented, centered on people's needs and well-being. So this time, gi-ensure nila sa ato nga makahatag sila og automatic inclusion of every Filipino citizen to the National Health Insurance Program or NHIP. Ang covered niini mao ang tanan nga Filipino nga maka-access sila sa population-based ug individual-based health services. Ang pangutana, kinsa may muhatag niining pondo sa population-based? Ang tubag, the national government ug ang DOH. Meanwhile, ang individual-based health services is funded sa PhilHealth or Health Maintenance Organization and private health insurance. Talking about PhilHealth, ang National Health Insurance Program na ay membership nga gitawag nato og direct ug indirect contributors. Ang direct contributors mao ang kadtong mga employer o employee relationship diin kung di sila makabayad naa sila penalty nga 3% for the employer and 1.5% sa employees. Meanwhile, ang indirect contributor mao kini ang mga indigenous people, PWDs, mga indigent, below 21 years old or above 21 years old nga dili capable mo bayad ang SK ug uban pa nga not directly paying sa PhilHealth. Meanwhile, the pooling of funds sa PhilHealth is for all individual-based health services. Now, talking about service delivery, ang population-based health services, diin ang support niini mao ang LGU or national government as well as the DOH maghimo or mag-institutionalize og province and citywide health systems. Diin kinahanglan na sila primary care provider network, na sila epidemiologic surveillance systems or ESU, epidemiologic surveillance unit, ug na sila health promotion programs and campaigns wherein 1% of the total budget of the DOH is allocated sa health promotion. Sa health service delivery, nahitabo nga ang individual health services mahatag gikan sa PhilHealth tungod kay ilang bayaran ang health institution or ang health facility diin gibuhat ang mao nga service, ang personnel nga registered or maugyod ang dapat nga or trained nga mohihatag sa service. So, talking about individual-based health services, it is only done inside a health facility by a trained individual. Meanwhile, ang population-based health services could be outside the health facility and it's given to a large number of people or kadaghanan. Talking about organization of local health systems, again, there's what we call as the province and citywide health system. Diin, ang provincial health board mao ang nagmanage niini and The funds that are being managed is the Special Health Fund, diin ang budget gikan sa nakalain-lain nga government agencies and the DOH. Ang municipalities ug cities nga mao ang nga represent sa provincial or city health board or a part of the PWC HB or Province or Citywide Health Board, mao ang gitawag nato og Universal Healthcare or UHC integration sites. Karon, ato na pong pagkahisgutan ang health human resources. Nakalimot pa ko, no? So let me go back. Nga ang ato ding local health systems, nga provincial and city health or provincial and citywide health systems, kinahanglan magtukod og duha ka units, which is the Health Service or Health System Support Units or HSSU ug ang HSDU or Health System or Health Service Delivery Unit. Now, ang Health Service Delivery Unit is talking about the goods and services, while the Health System Support Unit mao in charge sa capacity building, trainings, professional growth, no? And of course, mao kana sila ang duha ka units nga mahimo sa province and citywide health systems. Ang Health Human Resource or Human Resource for Health kinahanglan na hipatik sa National Health Human Resource Master Plan or NHHRMP. Diin, kinahanglan nga ma-register sila sa PRC or Philippine Regulatory Commission ug sa National Health Workforce Registry. Once ma-register na sila, kinahanglan sila nga ma-address ang ilang mga needs, no, ang ilang pag-development sa through the National Health Workforce Support System. Ang Health Human Resource na gitawag natong scholarship ug training, diin gitawag kini nga ladderized program sa DTTBP or Doctors to the Barrios Program. Diin, after nila mag-graduate, na sila return of service agreement nga pagabuhaton for 3 years and additional 2 years kung mo-extend sila. Sa HRH distribution, naatay gitawag nga formerly known as Rural Health Unit, which is now PCF or Primary Care Facility, diin there should be one primary care facility for every 20,000 population or usa ka RHU sa kada 20,000 ka mga tao. For every RHU, dapat na usa ka doctor or 1:20 population, duha ka nurses, 1:10 population, upat ka midwife, 1:5,000 population, usa ka dentist or 1:50,000 population, RSI or 1:20,000 population. On the other hand, ang atong barangay, which is Barangay Health Center before, which is now known as Barangay Health Station, will only have one midwife or one nurse per barangay, one BSN, one administrative aide, one driver, and as well as one BHW for every 20 household. No? For the butika ng barangay, dapat na 1:3 barangay and 1 DSO per epidemiology surveillance unit or per municipality. So, let's talk about regulation or affordability. So, ang atong mga tambal is under sa DPRI or Philippine Drug Price Reference Index. No? So, nga ria, we talk about equity as well. Kinahanglan nga na-award nga 90 Ward 10 private sa usa ka government hospital, while the private hospitals will only have 10% ward and 90% private rooms. For specialty hospitals, dapat na 70% ward and 30% nga bed capacity for private rooms. Governance and accountability. There should be a creation of HPB or Health Promotion Bureau. Diin, tanan nga mga settings or tanang mga lugar is considered as healthy settings. No? So, the people should be healthy literate and have a healthy lifestyle. For governance and accountability, the health impact assessment will evaluate or will assess the PPPs or policies, programs, and projects and PAPs or policy programs, activities, and projects. On the other hand, Health Technology Assessment or HTA, mauusab ang mo assess or evaluate sa goods and services provided. So, ang body niini nga mo assess sa PPPs or PEPs is called HIAC or Health Impact Assessment Council, while ang HTAC or Health Technology Assessment Council mao ang governing body nga mo assess for the goods and services. Now, asa man kuhaon ang pundo? It is the source of fund for the Special Health Fund is from total increment from sin tax, 50% PAGCOR, 50% of the 40% charity fund or PCSO, premium contributions, general appropriations from the DOH. We also have PhilHealth subsidy, and of course, ang last but not the least, ang atong supplemental funds, no? Also, let us not forget that it should be dapat nga naa malink nato, malink gyud ang atong mga individuals or families sa tagsa-tagsa nga primary care provider o primary care facility, no? So that's it for the universal healthcare. Meanwhile, let's proceed to abbreviations. For our abbreviations, we have the following abbreviations. First, definition of terms. BOD, burden of disease. HIA, health impact assessment. HMO, health maintenance organization. HTA, health technology assessment. NHIP, National Health Insurance Program. SHF, Special Health Fund. CIF, Case Investigation Form. RVOC, Regional Vaccination Operations Center. HOCC, Hospital Operations Command Center. OHCC, One Hospital Command Center. DTP, Devolution Transition Plan. QMS, Quality Management System. ISO, International Organization for Standardization. DPRI, Drug Price Reference Index. PhilPen, Philippine Package of Essential Non-Communicable Disease Interventions. NEP, National Expenditure Plan. AO, Administrative Order. CNA, Collective Negotiation Agreement. COMDEV, Committee on Devolution. DAP, Development Academy of the Philippines. DBCC, so Development Budget Coordination Committee. DBM, Department of Budget and Management. DM, Department Memorandum. DO, Department Order. DPCB, Disease Prevention and Control Bureau. DPRI, Drug Price Reference Index. DSO, Disease Surveillance Officer. DTP, Devolution Transition Plan. EB, Epidemiology Bureau. ESO, Epidemiology and Surveillance Unit. FETP, Field Epidemiology Training Program. FHSIS, Field Health Services Information System. GEF, Growth Equity Fund. GIDA, Geographically Isolated and Disadvantaged Area. GPPB, Government Procurement Policy Board. HC, Health Center. HCPN, Healthcare Provider Network. HFEP, Health Facility Enhancement Program. HHRDB, Health Human Resources and Development Bureau. Again, that's HHRDB, Health Human Resources and Development Bureau. HSDU, Health Service Delivery Unit. HSSU, Health System Support Unit. HUC, Highly Urbanized Cities. IRA, Internal Revenue Allotment. IRR, Implementing Rules and Regulations. JAO, Joint Administrative Order. JC, Joint Circular. JMC, Joint Memorandum Circular. LCE, Local Chief Executive. LGC, Local Government Code. LGU-HSC, LGU Health Scorecard. LIPH, Local Investment Plan for Health. ELIMS, Electronic Logistics Management Information System. MOV, Means of Verification. MTIP, Medium Term Expenditure Plan, NEP, National Expenditure Plan, NGA, National Government Agency, NHWR, National Health Workforce Registry, NHWSS, National Health Workforce Support System, NOH, National Objectives for Health, NTA, National Tax Allotment, OEP, Organizational Effectiveness Proposal, PAPs, Project Activities and Programs, Activities and Projects, PCF, Primary Care Facilities, P-CWHS, Province or Citywide Health Systems, PGS, Performance Governance System, PHFDP, Philippine Health Facility Development Plan, PhilPAN, Philippine Package for Essential Non-Communicable Disease Interventions, PSA, Philippine Statistics Authority, RA, Republic Act, RDT, Rapid Diagnostic Test, RESO, Regional Epidemiology Surveillance Unit, UHC, Universal Health Care. So basically, that is all for the universal healthcare. Let's tune in for another lesson later on.